Hello everyone, I am Dr. Tushar Pandey. So today's topics that I am going to discuss are two important OHAs, oral hypoglycemic agents. Number one is metformin and the other one are the sulfonylureas. So metformin, what it basically does is it that it inhibits gluconeogenesis. Gluconeogenesis, that is synthesis of glucose from entities except these carbohydrates like amino acids and proteins. So basically it has an anorexic effect which ultimately leads to weight loss. And this inhibition of gluconeogenesis, what it does is that it increases the utilization of glucose in the peripheral tissues. That is, instead of using other products, whatever glucose the tissue is having, it will start to use it rather than if promoting a gluconeogenesis with burning fat or proteins. So advantage of metformin use is that there is no hypoglycemia, number one, and no plasma level monitoring is required. No plasma level monitoring is required. What we should remember, and as a hematologist, what I every time ask with the patients that present with pancytopenias first is that are they a diabetic or on a chronic therapy of metformin, because vitamin B12 deficiency is very commonly associated with the prolonged use of metformin. We should remember these points. Now moving to contraindications to metformin. So we should know what are the contraindications to metformin. So an EGFR, now there's various ways to calculate the EGFR, this glomerular filtration rate. So we have the best method for adults is the Cockcroft-Gault formula. And according to the Cockcroft-Gault formula, if the EGFR is less than 30 ml per minute per 1.73 square meters, metformin should not be given. If it's between 30 to 44 ml per minute per 1.73 square meters, along with an active kidney disease that is progressing, again metformin should be avoided. Then if there is an active or progressive liver disease, it should again metformin be avoided. If the patient is very active alcohol abuser, cannot stop using alcohol, it intakes, has a history of excessive alcohol intake, actively taking, we should avoid metformin. And if there is an unstable or acute heart failure, we should avoid it. In addition, also if there is history of lactic acidosis associated with metformin use in the past, then also we should avoid metformin. And final is that if there is any signs of any hemodynamic instability, hypotension, tachycardia, anything, we should avoid metformin.